Hayley asked me to do this little bit, which is, again, rather a sort of tying things together bit, really, thinking about all the things we've discussed so far, and then thinking, well, what's the survivorship program actually done locally? And the phase one stuff was very early days. You know, survivorship was new. No one really knew where it was going. And so a few years ago in Sheffield, we started the work on what turned into all the colorectal stuff that you heard about earlier from Georgia. And I think, you know, we did a lot of work. Shauna Min has joined us now. You know, we did a lot of work thinking about what a risk stratified pathway should look like for a colorectal patient, and we did some work with the breast pathway as well. The other things that were going on around that time were lots of information gathering, lots of work within the services and in all the different localities, trying to figure out what it was that your patients, our cancer survivors, really wanted and needed. And in those early days, it was a lot of information gathering and learning and surveys and all that kind of thing, really just trying to get to the stage where we could think about what we would want to do in terms of projects and developments. And also, in that bottom bit there, just understanding what we didn't have, what we didn't know, and what we thought we might need for the future. The phase two bit is what we've just been doing. This is what we were talking about this time last year when we all met, and those projects that are now, some of them still going, some of them wrapping up or finished, building on the phase one learning and actually implementing some of those pathways and designing how things should look in the future, and also actually starting to implement elements of the recovery package. And as you've heard, that's been going on in various different localities, in various different forms, with various different focus in the different localities. But it has allowed lots of innovative work in the voluntary and third sector. It's allowed the NHS to focus on what its changes are going to need to look like. Where it's got more developed work in colorectal, we can now have a clear idea from that and from where similar things have been done in different pathways in other areas of the country, what we might want to do in the future. There's been an awful lot of sharing of those projects and best practice across the different areas. So, what's it going to look like going forward? I've occasionally heard two words being mentioned as I've gone around today. Those words are phase three. And this mythical phase three, what's it going to look like? Now, it's fairly obvious it's going to build on what we've already heard about, what we've already done. And it's the reason I think that this has been slotted in here by Hayley after you've heard what the commissioning agenda and the commissioning view is that all of the things that are up there in terms of how we've learned how to engage stakeholders, including our users of the service, and the things that we know help us to enable change, are going to inform what goes on in the next stages. And a lot of that will be actual working together, all the CCGs on the same page in this area, actual working towards joint plans and commissioning permanent change in services, so that risk stratified pathways are not unique in colorectal in Sheffield. They become normal once the patient finishes their curative treatment, that it becomes normal that they are having received all of the things that we see in the recovery package and having had health and well-being help, and that they have carefully transitioned back to primary care with excellent treatment summaries, and that primary care is enabled and resourced to look after their patient and all of their concurrent long-term conditions and comorbidities that we've heard about for the long term. So it's not about 6 monthly going back every 5 years for the 5 years. It is about having your treatment and then being transitioned very carefully back to your life away from the hospital. And to do that across lots of different cancer pathways, and to do that across this whole region is an enormous amount of work, which is why it's going to involve everybody pulling together in the same direction. It's going to involve all of the stakeholders all being on the same page and seeing that this is what's going to happen, and that is the next steps. And that kind of joint vision and joint commissioning change is going to be what phase 3 is going to look like. Just that as the last slide, not to lose the sight of the holistic pathway for the patient, and making sure that this Macmillan Survivorship Programme really does achieve those aims, so that patient experience, transitioning from treatment, is as we aspire it to be. Thank you.